Awesome. So first and foremost, I'd like to thank you for coming on the show. I greatly appreciate it.
Yeah, I'm excited.
Yeah, I know you're really, really busy with with becoming a doctor and training and everything like that. So how did you like get into like wanting to become a doctor?
So my mom is a physical therapist in South Texas, and her practice, I really appreciate it because it's a little bit different from most physical therapists practice. You know, they do a lot of ortho, things like that,
Mhm.
athletes. She treats a lot of people. She's a contractor. She does a lot of underserved populations, which is a
Mhm.
big eye opener. And I went to physical therapy school. So I got accepted to physical therapy school. And although it is now a doctorate of physical therapy, we still have a lot of not as much, I would say, autonomy with patients in
Mm.
that, however, we are educated a lot. There's still limitations as to how much we can treat a patient because it is still just, treating um, with exercise.
Yeah.
So I was thinking, okay, like exercise is great, but I do want to treat a little bit more holistically because I'm very good at the other components of helping people with their health. I wouldn't say I'm really good at, but I'm like pretty good at reading blood work. I
Mhm.
can take history, and I usually I have a pretty good idea of the diagnosis. And these are all just things that I learned on my own. Like I didn't learn it in PT school just because I
Yeah.
enjoy doing it. And I really enjoy like helping people, I guess, optimize their lifestyle. It's really fulfilling for me. Anyhow, I was, just like, okay, well, physical therapy is not going to give me that fulfillment of
Mhm.
treating each patient very holistically.
Yeah.
So then I applied to medical school, and here I am.
And so you got in, and now you're like, is this your first, like, I guess you call it a semester? Like, are you just getting in?
Yeah, so this would be my first at this school. It's called first trimester.
Okay.
So that's what they call it. Each school
Yeah.
has different semesters.
Cool. Cool. So what are you like hoping to like, is there like a particular field you're hoping to get into once you get out, or, how's that
Yeah.
going to go?
So I personally enjoy a lot of neurology. And if there's some of your viewers who aren't familiar with neuro,
Mhm.
um, basically it's stuff from like brain balance, how your nerves talk to your muscles, and other physiological effects of your body.
Yeah.
I'm really interested in the neural pathways, and I say that I speak in neuro, and that there's people who are like, oh yeah, like this nutrition plan will work this way for your body, but I'm like, it's going to have this effect on your brain, and then this effect on your brain is then going to like affect this, but it's the same thing, but it's just like, I guess it's kind of like a different language.
Yeah. Yeah.
So there's that. And I really would like to kind of, for one, make a lot of breakthroughs if I'm smart enough with neuro, because I think the brain and a lot of like mental health things, it's not as well understood as other diseases because we cannot like physically see a broken brain. We can see a
Right.
broken leg, but you can't see. So people aren't like, oh, okay, like I get it. I get your mental health problem because like I see it all the time with like my two eyes. You don't,
Mhm.
and it's understandable. There's still a lot of things that physicians and just any clinician don't understand about how to treat the brain because it's such a dynamic, just a different
Yeah.
special organ.
Yeah, my wife used to work. So right now she's about to finish up nursing school, but she used to. What kind of got her into like wanting to be a nurse is working at the front desk in neurology. And we have a hospital here. It's Vanderbilt. It's
That's
called
awesome.
yeah, it's a mega hospital. So she saw a lot there, and you're absolutely right. Like neurology is such a tricky thing because there is no concrete a lot of times diagnosis for a lot of time. For a lot of things, it's just like how can I put this, like you're looking at like all these different variables and you're trying to determine what it possibly could be. Treatments are often like hit and miss because of that. So what you'll have is you'll have people that are being treated and then like they're not getting any benefits. And so it's an odd place to be because you're being treated. You need time to see the fulfillment of that treatment because nothing works like immediately in that field. So you can wait up to 6 months or more, figure out it's not working, and you have to switch to something else. And then and the process goes on and on. And if you can get relief, that's great. But some people, it could be years before they find the right medications, the right protocol for, to get some relief. It's a really like sad situation. And a lot of times, like when you see these patients, so definitely like need more people going into neurology, because that's a field that's really underdeveloped, so.
Yeah. I mean, like one main thing is like, I really hope to not have, I mean, as much as I can, I'd hope not patients to not have to go through that trial and error, and this didn't work, and like the doctor can't give me an answer. And that's again like why I really want to treat holistically, because there's other things in the body that affect what happens in the brain. And so if you can kind of control what you can, then the brain will act accordingly, So
yeah. I mean, for sure, there is a like a natural aspect to things that a lot of times people are not doing everything that they can on the natural end of things, and they're just jumping into like medication, and it's kind of like
because their physician didn't tell them,
Right. Yeah. It's tough. But that's, I mean, that would be awesome for you to get into. And I thought to your point, when you said that you're kind of, like you kind of already know like blood work and stuff like that just intuitively, or you've kind of like figured it out on your own. It's interesting because I'm taking some medical courses right now because I'm prepping to go nursing when she gets out. And so it's funny that like, because of my like bodybuilding or fitness, like lifestyle, I'm used to reading my blood work. I kind of know certain things already.
That's
so
good.
Yeah, so when I'm in class, I'm kind of like, oh, I know that. We're just going through the endocrine system right now, and it's like, oh, I'm pretty familiar with that, so it's always interesting.
And it's good because I really think that fitness and bodybuilders, they look at things at such a different, and we need to appreciate it, angle that clinicians don't think about. Because again, bodybuilders look at their body as a whole and how things work in their day-to-day and what's going to work and what's not. And as a bodybuilder, you have to know your body very well.
Right.
They're very self-aware, and that's one of the problems with the unhealthier people. And then they're just kind of like asking the doctor, what do I do? I don't know why I'm hurting, And I think, people have so much to learn from bodybuilders. They're not, a lot of them are not medical doctors, but a lot of them know so much about just, again, like I always say holistic care, because it's all one piece, your body. And that's the special thing about bodybuilders, that they look at it so differently than any other clinician you're going to find,
Yeah. I mean, I'm definitely not, not advocating somebody, not use a trained medical professional like a doctor. However, with that being said, I will also say some of the best advice that I've gotten have been like from like an older bodybuilder who's been around, who's kind of like coached a lot of people, and they know how the body works intuitively. And so I completely agree with you. How did you like get into fitness and training? You're obviously like, geared towards the sciences and things like that, but when did you start, being interested in training?
So this is a question that I just love. I love to answer. So when I was about, I'm going to say maybe 12, that's kind of when like a girl starts to develop a little bit. And I noticed that just a lot of guys, they're, disrespectful to me, as other girls had experienced, they're hitting on me, saying like catcalling and all that shit. And I, of course I didn't like it. And I was like, what can I do that these guys will stop doing that to me, or they can expect? There's nothing that I can do. I was like, I can cover up or wear as little as possible. I can have a different attitude, but it's just, it's not gonna change anything, because it's not really my problem. So I was thinking, if I can just get like really jacked, like the first thing about me is not going to be like, oh yeah, she's like super hot. They're going to be like, wow, like I'm going to respect her because she knows what she's doing with her body. She's not just trying to get attention. you know?
Yeah.
So that's how I got into it. And
That's probably like the most unique like story of getting into training like I've ever heard. Like I've had a lot of episodes and a lot of shows, a lot of people on, and I've never heard anybody say that they, as a female, they wanted to like work out so the catcalling would stop and then they would be more respected. Like that doesn't, like I've never had anybody say that before. That's interesting.
today, yeah, like I think it was like the other day, like a guy was like, "Why are you so big?" And I was like, "It doesn't matter." Like, so guys like you won't come up and question me. Oh my God. Doesn't matter.
That's hilarious. So
So yeah.
did you now I'm by your screen name, I'm judging that you were like involved in cheerleading as well, right? Competitively.
Yeah. So it's so funny because I didn't actually give myself that name. I always tell everybody I didn't give myself the buff cheerleader. When I was in college, I became a cheerleader. And a lot of people, they just didn't know my name, but they'd be like, "Oh yeah, like the buff cheerleader, like that girl who's like buff and she's a cheerleader." And everybody would just call me the buff cheerleader. So I was like, that's kind of a cool name. So I just put it as my name. But yeah, it was actually, cheerleading is something that I would say is the hardest sport, but because it's, I don't know, it's just like a big outlet for me in my life. And I mean, I can expand more on cheerleading, but whatever you want to know.
Yeah, I mean, well, so like for example, like I was always kind of thinking that, most people when they hear cheerleading, they don't think of it as being like that difficult. They're thinking of maybe, somebody who's like the girls that you see in like the halftime in basketball or something like to that effect. But there's a whole side of cheerleading that's like the competitive side that's almost like you would say would be like comparable to like a gymnastics or something like that, right? To that effect. So like, how was that experience for you there?
Well, because I've done gymnastics as well. And it's personally, I don't know if there's other people have other opinions, but that's okay. Personally, it is way harder than gymnastics. Again, like I've done every sport. And it's so hard because for one, you have to have a lot of cardiovascular endurance, which, normal. But what you're presenting to the judges to compete with, it's only in 2 minutes. So you can't fuck up in those 2 minutes. And if you choke or if you get nervous, when you go out there on that stage, you have to give it your all. Other than that, you still also have to trust your teammates not to choke, because if they choke, then you're going to have to pick up their slack. For instance, my biggest fear is always that my flyer is going to get scared, which is normal, and then make a slight, like not jumping as high. And when that happens, people will get hurt.
Yeah.
Like they will get hurt.
Well, explain what like flyer means, because most people probably don't know what that means.
Okay. So in a typical all girl stunt, we have usually 3 bases and then 1 flyer. And there's a main base, which personally I would say kind of controls the stunt. And a lot of the weight is on the main base. And then you have the secondary base, which sort of balances the flyer. And then there's the back spot. I've never done the back spot position, so I don't know a lot about that. But then you have the flyer who goes up and looks pretty and does all that stuff. However, it's very nerve-wracking to be the flyer because they're the face of the stunt. And they're doing things that are defying gravity. And then as the base, you have to trust the flyer to not fuck up and not come down wrong. I've gotten like so many stitches in my like eyes because they get scared.
Like, how would that happen? Like, how did you like? How would your eyes get hit? Like, how'd that work?
So when a girl comes down, they have to come down straight, like very clean. And if any of their like limbs are like loose or out, then it's gonna hit something. Usually it's an elbow, because when you're
I see. Okay.
I guess you want to like spread your arms. So the elbow comes to me. And I mean, it's happened and it is kind of scary because I do faint in my own blood. But that's just the thing. Like, it's a very, very like contact and teamwork type of sport. But then you also have to kind of have your own endurance with like when I'm done. Like I consider myself pretty athletic. But when I'm done with a full out routine, like I feel like all my organs are like on fire. It's the worst. It's the worst feeling. But it's so fulfilling.
Like
And I've
from
never
the
felt that way.
adrenaline? Is that like, you mean like just from being excited, or, you know, from, or
No,
how?
I would say from like a science perspective, for all your organs to work, you need to get enough oxygen to them. And if you don't get enough oxygen to them, then it's not very happy. So
I see.
you're breathing hard. And then of
Right.
course, if you're out of shape, then you can't get, the oxygen to your organs. And then you just feel like you're dying.
Right. Yeah. I've
But it's
had a,
fun.
I've had like a situation. I went to try out for like the fire department, and there's like feats that you got to do, like climb like 100-foot ladder, like carry stuff. And I don't think I've had an adrenaline dump for quite a while in my life. Maybe when I was younger, like involved in like different athletics and stuff like that. But it's been some time, and I've had it like during that process, and it's the most insane feeling, because it's like you're doing everything, and all of a sudden it's like you have like absolutely no energy, like you're completely exhausted, you can't breathe. It's a
Mhm.
it's a odd, feeling. And then like after you kind of, so to speak, catch your breath or kind of relax a little bit, then all of a sudden, you're back to normal, and you're like, what happened? Why? It's kind of like I was fine, then I wasn't, and now I'm okay again. Yeah, it's strange. So
Yeah, there's like girls. I mean, I've seen it. I don't think it's really happened on any of my teams, but I've seen, because I used to judge cheerleading competitions. I've seen girls like throwing up, breaking their shit, breaking their like foot, like on stage, and they're still going. It's fucking
yeah,
crazy.
yeah.
And but that's just like how, to me, that's how hardcore the sport is. Like there's a lot of girls, you do have the option to like call like a timeout, like stop the routine. But a lot of the cheerleaders don't, because it's so
Yeah.
muscle memory, and it's just, I don't know, they don't. They're throwing up and they're like breaking their shit, and it's fucking awesome. So
Crazy.
yeah.
That's crazy.
Yeah.
So, with you competing and everything and cheerleading, and then, training, you're getting, you're pretty muscular. Like, have you ever competed in like bodybuilding or in the fitness industry at all, like on stage?
Yeah. So when I actually, right before the summer before I started college, I was like, I want to do this for fun, because again, like fitness has always just been something for fun. I don't say like, yeah, I'm a bodybuilder, it's going to be my career. Like, it's just something that I always have done. So I was like, I'm going to do this for fun. I'm not going to have time any other time. So we're going to do this the summer before college. So I did it. It was so fun.
Yeah.
It was kind of right when fitness started to get a little bit more popular. It was 2014. And then I started to train for like a wellness competition, but I didn't want to do wellness because it was like I didn't fit in, because I got a coach. And then now I want to do physique. So
you want to do physique now?
Yeah, women's physique. I know I'm not that big, but I will want to like grow into it. Like I will want to like put on some size.
Yeah.
So that
how come you didn't want to go wellness? Just not feeling it?
Yeah, like I would do the poses and just kind of like the community. Not that the wellness community is not like, it's not a good community. I just didn't feel like I fit in. I feel like maybe I was just a different competitor. And when I started prepping for women's physique, I was like, wow, like I love this. I love the training. I love the poses. I just love everything about it.
Yeah.
And once I started training for physique, like, oh my God, I was so happy. Like the whole world changed. It's just a different it's a different kind of like lifestyle, and I just loved it so much. Like I just felt like I belonged. So
yeah,
that's what
that about the posing, that's definitely true, because wellness has more like of a bikini style posing, and and women's physique is a lot more like involved. It's a lot more bodybuilding-esque. I mean, you're able to really, I feel like with that kind of posing, women's physique, you're able to really show your development a lot more. It's there's just more going on. Did you get a chance to catch the Olympia this last year with women's physique?
Yes, I didn't catch the whole thing, but yes, it was great. I appreciated a lot of their routines. And then right after that, I was like, oh my God, like I need to practice posing.
Yes, absolutely. So like, it was interesting because this is, I watched the Olympia, but like this last one was so exciting too, especially women's physique, because Sarah, the lady that won for the second time in a row, her posing routine was incredible. And I was like, I even showed my wife, like she doesn't watch it as much as I do, but I was like, you got to see this. And she absolutely agreed, because I mean, that was fantastic. You want to learn how to pose, you watch that, that lady,
It can be appreciated by anybody,
yeah, she's, well, it's a big thing now, because you can have like the greatest physique, you can be a Olympia champ physique, have an Olympia champ physique, I mean, and not be able to show it right, not be able to pose right, and then you really could get placed low. And it happens all the time, because you'll see people like on their Instagram pictures and so forth, and they're like, wow, this is Olympic caliber physique. But then when you see him on stage, it's like, what happened? Yeah.
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 Yeah. I feel like, I mean, I don't know a whole lot about posing, but I think the mindset that you kind of have to have is like just a true like appreciation for the aesthetics that you're presenting, and just like a lot of respect for, what you've created. Because I think if an athlete forgets that and they just kind of get into like the other components of body, honestly, just don't even really matter. You start to forget, and then it shows, so you want to like put, I guess, like your whole soul into showing the aesthetics that you're giving. And just like what is it? Kind of appreciation of the body.
Yeah.
Because,
yeah.
Body,
I mean, from the mental standpoint, for sure. From the physical standpoint, like I feel like some people could benefit from coaching. I feel like everyone can benefit from a posing coach, but some people more than others, because it's like it's kind of like some people kind of intuitively know how to dance and then others don't. And, and it's like, so if you're one of those that don't, which I'm in that category of not knowing how to dance. Yeah. So it's like, you need somebody to kind of show you that flow. It's like, otherwise you won't be able to get it by yourself. And that's sometimes what I'm seeing, so.
Oh yeah. Yeah, I think, and a lot of people, especially, just kind of the nature of bodybuilders, we're type of people, we don't like to be told what to do most of the time. But I think, being open-minded and just being like, even if whatever coaching or whatever is not for me, at least I'm exposed to that, that variable, that opportunity, because then I'll kind of figure out what I want to do for my own body.
Yeah, absolutely. So do you have like do you have a time frame or like a date where like you're thinking you might, step on stage? Are you gonna, start prep soon, or are you in the middle of it?
So yeah, right now, I'm kind of doing some growing. Well, a lot of growing. My coach, Matt Cusano, what he likes to do is he'll take a few months and kind of just, he's really good at listening to his clients' bodies. So he'll, take it week by week and see where we're going. And if when we stop improving, make some changes and see just as much as we can grow. And then at that point, then he'll be like, all right, we're ready to just start show prep.
Yeah.
However, he won't set a specific date or a specific time. He'll maybe say like around this time frame, but we're not going to choose a show. We're not going to set a specific date, because we're going to listen to your body. We're not going to listen to the show date.
Yeah.
So because he's like, if you're 2 weeks out and you still look like shit because the body isn't responding as well, then we're not going to force you to do that.
Yeah.
That's something that I really do value. So what he does is he'll then get you show ready as best as possible, and then pick a show when you look like you're about 2 weeks out.
So do you like when you're doing that? I know you don't have like a time frame set, but how long does that usually would take for you?
For me, I would prefer like a solid year. I know that people are like, yeah, 16-week prep, or whatever, but I do like to go into, obviously the growing I don't want to say bulking, but like the growing phase, and just see what my body can do and where I can take it.
Right.
And then going into the show prep phase. So I would like to comfortably say, a full year, just to like rushing it, not putting your body under so much pressure to grow and then to cut. And then that's not like
so you're including like the off season as well into that year. So you're saying growing phase as well. So, and especially with the women's physique, that's a requirement, of quite a decent amount of muscle. So it's like that would be helpful to have that time as well.
Yeah. Because then, you have a lot of very ambitious athletes and they're like, we're going to put on a lot of muscle. And I'm sure they can put on a lot of muscle in a very short amount of time. However, not the most healthy,
Absolutely. Anytime you rush, the process, it's going to have an effect, whether you see that effect now or whether you see it, 10 years from now, it's going to have an effect. But that's kind of how like people are, right? It's like, they're more like I won't say self-gratification, but like immediate gratification. They want to see it now. And if it doesn't hurt them now, they're fine. The problem is when it does come back to hurt you, you're going to wish you didn't make these choices, and it'll be too late then. So,
yeah. And sometimes it's a learning curve, but that's the beauty about bodybuilding, trial and error. You learn your body and you get to know it. And hopefully you don't fuck up your body at all.
Yeah, that's the goal, right? And so this last year had quite a few, I don't know if you keep up with the names elude me, but there's a lot of people that passed away. Sean Roden was probably the biggest name that passed away. And so it's a lot of people point to like performance enhancing drugs, which obviously, they play a factor, but there's also other things like size and how much people are eating and, and genetics. That's not, genetics. So
like one thing I will say again, as like from a physician standpoint, there's a lot of people who are just so healthy. But if you think about, the heart problems that people have not because of their unhealthy lifestyle, but because of the stress that they have. The stress that, stress hormone, if you have too much of it, it can just kill you from the inside out.
Yeah.
But people, a lot of the times when people do a blood panel, they don't look at those things. They don't consider them. And all of a sudden they have a heart attack. And then everyone's like, what happened? Like he was so happy. But in reality, like that's just a very fair component. And my coach really does say, like, you're not going to let your body like get fucked up just from you stressing out so much over things that you don't need to stress about. He's very big on that.
Yeah. I mean, it's again, like we were talking earlier in the show about neurology and how the brain, you can't see it broken. Stress is also like one of those things you can't see it, so people don't pay attention to it. It's like you don't see the physical harm that it's doing, so people don't worry about it. But when it's when it reaches the point where you have to worry about it, it's too late. So you need to really address those things early on. So.
Yeah, I'm sorry, were you going to say something?
No, go ahead.
And I know a lot of your viewers don't know a lot about the things I'm about to say. So like your sympathetic and your parasympathetic states are very important, meaning your rest and digest and your fight or flight. You can be a very healthy individual. However, you can be stuck in the sympathetic, which is your fight or flight state, which is not going to help with your overall life. And when people are stuck in that state, those are the ones who is just like, oh, all of a sudden they died. But it's because a lot of that, like taking people down into that parasympathetic state where they can actually rest, lower their heart rate, or just, recover, have their body recover, not only their muscles, but, everything else. It's a huge thing. And then I've noticed, especially I think here in America, because it's a very fast-paced culture. It's a very business-oriented culture, which is good. However, not good for the body's recovery, the mind's recovery, and all that. And again, we don't see it. We don't see that at all. So it's the last thing people think about, but it'll really fuck somebody up.
Yeah, it's a hustle and bustle society for sure. And so, there's consequences with that. That's why, and you're not going to be able to change the society. So you have to kind of address it within yourself. You have to make the choices for your own health. And, I think that's kind of, that's a big component to it too, is everyone has to be like their own advocate in of their health. It's like you can't depend on, while doctors are there to help you, and they can assist you and they can do a lot of things, you really have to advocate for your health. You have to ask the questions, everything like that. It's like, if you sit back passively, that's nothing good can come from that. So
yeah, and I mean, hope to be able to be one of the doctors who's able to just be like, like, aside from like this other like thing, like, let's get to the root cause of why your stomach hurts all the time,
yeah,
because then that could be a good telling factor amongst other factors. Which again, like, I know, which is again the thing that I want to make the change in medicine, is I know that there's a lot of physicians who don't do that, and I would love to be a physician who is able to kind of look a little bit deeper into the patient's issues. Where was I going with it?
Well, we definitely need more of those. That's for sure. And I think we're going down a rabbit hole here, but let's go ahead and just for a minute go into it, because with the way the hospitals and things are set up, like, I believe, if I'm not mistaken, and when my wife was working in on the front desk and stuff, the scheduling was like 15 minutes a patient, like 15-20 minutes a patient. How can you assist somebody, treat somebody 15-20 minutes? And I get it from the standpoint, oh well, they see more patients, but it's like, but if you're not, how can you help them? So they're there, you're probably prescribing some medications, but honestly, you really can't get to know somebody's problems in 15-20 minutes.
Oh my God, I don't want to say too much on this, but there was my actual physician. She is totally opposite. She's very smart, and she treats amazingly. And I was telling her, and I was like, I really appreciate that you actually took the time to say, tell me about yourself. How many physicians will do that? And like, Lexi, I cannot treat like that. I just would not go home happy that way. And I was like, you know what? That's the physician I want to be, because that's why I do it. I want to feel fulfilled. I feel fulfilled when I can remember, like, hey, that patient went home, and they weren't questioning if their care was efficient enough. They should never question.
Yeah.
And they should never question or think about, like, do I trust this physician? Because I know there's so many patients who don't even know if they trust their physician.
Yeah.
And it fucking sucks. And I've had treatment like that, and they're talking too fast, and it's just,
you just become being a number, like, to them. And I've had physicians like that too, and I've had to step away from them and find somebody else. It used to be, when I was younger, I wouldn't bother with it, but now as I'm getting older, I'm like, no, I mean, I'm coming in here, I'm either I'm forking out the money, or my insurance company's forking out the money for this particular treatment, so or physician, whatever you want to call it. And so I feel like I need to find somebody that I feel works well with me, so, and that's what I do now.
And I could go on about it, because I've heard so many stories of people, and I'm just like, I'm so sorry that you had that type of medical treatment. It's too many that I hear, and I wish I could change it, but you can't save everybody. That's
also 100% true. So that's why you got to make your own good decisions. But to pivot back to the fitness and training, have you coached, or do you help people at all, like answer questions, or train?
So basically what I do, however, I'm probably not the best to ask, because I'm a person who's very like, it depends on your goals. It depends on the person you are. It depends on your blood work. So what I usually do when people ask me about tips and stuff, I say, I'll tell you what has worked for me and why. However, as an athlete, you guys need to go and, probably hire a coach or, get to know your body on your own. Because for me, it took years. I started when I was I think I was like 16 or 17. And I thought I knew everything and I didn't. The next year, I thought I knew everything and I didn't. And, I'm pretty sure I don't know everything because I'm still learning more things and things that, that they don't teach in medical school, but, a coach would know.
Yeah.
So I think I would not really be that great at coaching because I'm rather be a clinician, but I am always happy to help people, with questions, because a lot of the times the mistakes that people make with their bodies, they just don't know.
Yeah.
And I'm always happy to help with that.
Yeah.
So
yeah, that's awesome. That's awesome. So if somebody wanted to reach out to you, I guess to kind of close out our episode here, if somebody wanted to reach out to you just for some questions or, something like that, maybe even have you on other podcasts, what would be the best way to reach out to you?
Yeah, Instagram, the Buff Cheerleader. I could drop my email too. Aleksi, Perez. But yeah, definitely. And then also I could link them with my coach who does a lot of like Q&As.
Awesome.
And he's
great. And I'll link everything at the bottom of this video, guys. So if you want to check it out, definitely do that. And Aleksi, thank you so much for coming on the show. I really appreciate it.
It was awesome. Yeah. Had a great time.
Take care. Have a good day.